What's up, good people? Today I'm gonna talk about a game-changing thing. It's a huge research and you can look at it. It's so recent. I'm talking about it just right now, right after it. The thing is, the thing is that coffee has always been thought of being a bad thing, especially for the people who have heart problems. But now they have done a huge research. It's not a small research. They studied close to 500,000 subjects. Yes, close to 500,000 of the people were studied in this research, and they found out what you see in this headline of medical news, that coffee is linked to reduced cardiovascular disease and mortality. Let's talk about it in more detail. Let's go over what the research review says and let's talk. So, it's basically related to any sort of coffee. It could be, ground coffee, instant coffee, even decaf is thought to or found to be important in reducing the cardiovascular disease related mortality. The key word here is new. That's the thing that I want to hit right here, that it's a new cardiovascular disease related mortality. Let's say if you already have cardiovascular disease, let's say you have atrial fibrillation or atrial flutters or cardiac arrhythmias or CHF, then you have to be careful. But if you have not been diagnosed, then this thing is going to help you. By that thing, I mean coffee is going to help you avoid cardiovascular disease related mortality. And it's not related to one particular type of coffee. You can have any type of coffee, and even decaf coffee is proven to be beneficial in this. So let's move on. That in this study, they first this is the study that is first to look at the differences in the coffee subtypes. Honestly, I've been through a lot of studies, but I did not find a study that will talk about the subtypes of the coffee, like the decaf and stuff. So that's the beauty of this research, and that will help us find out the mechanism that why is coffee useful for cardiac patients or useful for people who are trying to prevent heart disease. So daily coffee intake should not be discouraged. That's the agenda of the results of this research, that physicians used to discourage coffee intake, especially for cardiac patients, especially for those who had cardiac arrhythmias, atrial flutters, and atrial fibrillation, and so on and so forth. But now, after this huge research, they are saying please don't do that, because they found out some benefits, because this study supports that coffee is safe and even potentially beneficial, which is consistent with most of the prior evidence. So think about it, talk to your doctor about it. And they said that we do not prescribe coffee to the patients, but for the majority who like coffee, they should be or they could be encouraged to keep taking coffee. It's not gonna hurt you. Look at the thing. That's why I was saying close to 500,000, because it's 449,563 UK Biobank participants, and the mean age was 58. That's not old people, that's not too young people, but that's a really good subject, population that you want to study. And 55% of them were women, and they were free of arrhythmias or cardiovascular disease at the start of it, and they reported the benefits. And let's come to the quantity of coffee. So drinking 1 to 5 cups per day of ground or instant coffee, but not decaf, was associated with significant reduction in incident arrhythmias. The lowest risk was found in those with 4 to 5 cups a day. Imagine, those who took 1 to 5 had this much reduction of the risk of arrhythmia, and 4 to 5 cups a day gave even further risk reduction of arrhythmia. And that's a huge game changer. Honestly, That's a huge game changer. And habitual coffee drinking of up to 5 cups a day was also associated with significant risk reduction of the cardiovascular disease compared to the non-drinkers. And what they found out that coronary heart disease is when coronary arteries, which help sustain your cardiac muscles, those coronary arteries get clogged and blocked, and then you get heart attack. That's what happens in that CHD, and the coffee is gonna reduce that. And especially those who are habitual coffee drinker and they take like 5 cups a day. And even in those who were taking 2 to 3 cups a day, they also had the beneficial effects towards their heart after taking coffee. Another very important aspect of this research was they found out that there was also reduced risk of congestive cardiac failure and ischemic strokes. Ischemic strokes are when there is a blockage in one of the arteries in your brain area that leads to a death or infarction of that specific area of your brain, and then you end up with a paralysis. And that's what ischemic stroke is, which is just similar in pathophysiology to what you see in your heart failure. So coffee is reducing that incidence as well. And remember, this is based on studying close to 500,000 subjects. It's not a small group of people like 100 or 50 or it's not a small case study. It's a huge study. So, that supports, the beneficial aspects as well. And that's why the death was significantly reduced. And the game changer thing is it's reduced from all the subtypes of the coffee. That's the beauty of this study, that you are talking about the subtypes of coffee as well. And even if somebody is taking 2 to 3 cups a day of decaf coffee, they also had the risk reduction. And even those who were taking instant coffee, they had a higher risk reduction. But those who were taking decaf were also getting benefits. So why not? So that's why I want to talk about it. I want to discuss this thing, and it's going to help us all. So another thing is that why do you have this kind of benefit? Let's come to that. Just give me a second. Coffee consumption is associated with cardiovascular benefits and should not be discontinued, should not be empirically discontinued in those with underlying heart rhythm disorders as well. So if you have an underlying heart rhythm disorder, in my view, well, what I just read is a little bit different. In my view, if you have an underlying heart disorder, especially with the rhythm of the heart, please talk to your doctor about this first, because he needs to evaluate your EKG, he needs to look at your blood pressure, he needs to look at your pulse rate. A lot of things need to be considered before you blindly follow this statement that those who have heart rhythm disorders can take the coffee. So please be careful, please be cautious. That's why I started this discussion, that this relates to those who are newcomers who are trying to prevent this thing, not for those who already have a heart disease or who already have a problem, because this study focused mainly on habitual coffee drinkers. So it's not like you're taking coffee as a prescription. So please be careful. Talk to your doctor first. That's my advice to you all. Plausible mechanism is very interesting, and this receptor that coffee hits in your heart and in your vascular system, the cardiovascular system, is very interesting because we use certain medications in heart attacks and arrhythmias and other treatments of cardiology and cardiovascular system, that we hit this specific receptor, adenosine receptor, and interestingly, coffee hits that receptor directly, and that's why we see that the cardiovascular mortality risk reduction in those who take normal coffee is way more compared to those who take a decaf. Decaf coffee also gives a benefit, but The bigger benefit is to those who take the original coffee because of the mechanism that this is how coffee helps prevent you from cardiovascular problems and in turn mortality. Another thing is it has antioxidant properties, it reduces the oxidative stress, and it modulates your metabolism. And that's why it's very essential and very useful. So bring it into your habitual consumption. Don't take it like a prescription, and they need to study it further because habitual coffee drinkers get more benefit. And a fascinating and a very important benefit I found out is for diabetics and pre-diabetics. If you are a diabetic or pre-diabetic, you don't need to quit taking coffee. Why? Because it increases the insulin sensitivity, and that's what you are looking for in the treatment of diabetes, especially type 2 diabetes. And also for pre-diabetics, it's really beneficial aspect that you are responding better and better and better every day to your own insulin. And that's why coffee is beneficial, because coffee sensitizes your system to your insulin, and that's how it helps you to tackle the pre-diabetes. And also it's very important because of endothelial antioxidant properties. Endothelium is a layer in your vascular system where it acts directly as well as indirectly and helps prevent a lot of inflammatory mechanism and atherosclerosis and therefore cardiovascular problems. And another important aspect, which is like my favorite, is it helps reduce the weight, and that it does through the inhibition of gut fatty acid absorption. So if you had a fatty meal, let's say you had kadai or you had pizza or whatever you had that had a lot of fats, if you took a coffee cup with that, that's gonna help reduce the blood fatty acid levels, and that's because it helps it to drain out of your body unabsorbed, so body's not gonna touch it and it's gonna get passed out in your poop. Basically, that's how it reduces your blood fatty acid level, and that's how it helps you lose weight also. So you can add it to your meals in a very careful, cautious way. And if it's a habitual way to take coffee, go for it. I have nothing against it. And those people, from the research, is proven that those people who are habitual coffee drinker, they have a lesser incidence rate of type 2 diabetes. That's amazing. Why it does, I just explained it to you guys. So please, take it into consideration, discuss it with your doctor, and don't take your own personal decisions. And share this article with your doctors that how it is related to you and what can you do about it, how much cups of coffee you can take safely, and that's gonna help you a lot. It's gonna be a game changer. I want to bring it forward to you all because we need to create awareness. We need to reduce the fear of coffee from our people and tell them and educate them that here you go. This is how the things are. And please like, subscribe, and share to my channel. Thank you so much. Have a great day. Bye bye.